So for our gender dysphoria, it's the same. It's the same sort of process where if any of our patients are due any of their testing, they will sit in the enhanced service recall group for the month. So it doesn't matter about their date of birth. If they're due, they're due. It'll make sure you call them in because there's financial things attached and higher risk groups. But they'll also be in our gender dysphoria enhanced service searches. The top line is slightly blurred because it would show patient identifiable stuff later on. It's just saying that any transgender code where there hasn't been the ZV62A code and they're on hormone therapy, in case you've got people that you are prescribing to, where you might want to claim an enhanced service, but the enhanced service search we use is looking for the code they want us to use at the moment. That code may change. And we also need to know if they're getting injections. So we've got 6 patients in my 7,000 practice who have the gender dysphoria code. 6 of them are on hormone therapy, of which 3 are getting injected. There's an additional 110 a year for that. And then we have the audit. I can't show you that because it's showing patient identifiable information. But if I open up the Excel sheet, it'll show you what hormone treatment they're on. So estrogen, testosterone, estrogen. Have they had their annual reviews? Not yet, some of them. Are they up to date with some of their bloods? Mostly. There's one person here I think is a new patient to the practice. Now, I know that those patients who are overdue will sit in that recall group enhanced service. When we open the patient up, it'll make it clear to us that this patient is on the gender dysphoria enhanced service, or comes under that if we want them to, but they need their blood tests. And then if we click OK, that'll disappear. And you can see they're a new patient in my practice, and the alert box that I can't show you because it's got a name in it will say this person has gender dysphoria, they need their blood tests for the enhanced service. It also has a link to my template that will show you what we need for this person's enhanced service. Now, again, the blood test link will take you to the HCA template and it'll tell you can't see it here, but if you hover, it's telling me that this patient needs at least their full blood count, LFTs, lipids, testosterone. I know that there'll be a wide range of tests for enhanced service. So if I double click on this box, it'll show me what test this person needs. And it'll say that I need their blood pressure, that I need blood count, LFTs, lipids, prolactin, testosterone, estrogen. Their weight's been done, but it's there to record. We need their smoking status, and it's all suggesting Q risk here for them too. I can't remember if that's part of the enhanced service. I think it might be. Yes, it is. Now, if all we're doing is if we're the healthcare assistant who is just doing the initial process tests, then that's the only thing we need. If we're the person doing the annual review, I'll close this bit down and I would go back and I would double click on the yellow gender dysphoria enhanced service. So this is a bit like the chronic disease template. So if I double click on that, it gives a little bit of the advice from the enhanced service. I use the code annual health review. I couldn't see a code that it specifically asked for. So that's the code I use and that my audit looks for. So if you're using the template and you tick that, and it talks about things to watch for in trans men or trans women, the link to the very helpful email, and then always smoking, Q risk as part of the enhanced service at least once. It'll have the HCA phlebotomy processes below. And then if you want, you get anything blue, you click on that, it would take you to the enhanced service paperwork, and that's where this is an up-to-date thing. I mean, I think this is where just setting up the register in the first place is £250 first year, £100 a year for their monitoring, £110 for their injections. So if I go back to my patient group, in the first year we sign up, then I know I'll get £250. I'll get £100 for each of these patients for doing their blood tests, monitoring, and prescribing the hormones for them. I'll also get £110 per year for the injections, so that's £930 a year for a relatively small number of patients and relatively easy group to recall and bring back in. Now, if you're using my Eurocare approach, I know that these guys will get invited in this enhanced service group. The time of year that they'll get invited for their gender dysphoria enhanced service review is if they haven't had that code annual review and it's the month after their birthday month, because we're just keeping the same structure for that, so that I know that I've got a robust system for inviting them in. The template will show you what you need. The chronic disease template will give you links, the enhanced service, and the email advice and advice on what to look for as part of the enhanced service. And the search will still bring them back the month after their birth month for their chronic disease review. Again, the same template would pull in any other tests or processes they might need if they were on any other medications. And if they had other chronic diseases, it would pull in the other chronic diseases. So I'll show one example of the patient. So this is a patient in our gender dysphoria enhanced service. It's just telling us that they're up to date for their blood tests. And then it's advising that they're on high Ventolin, we should be considering green inhaler. Their DOAC LES is also up to date. We should consider coding CKD. They have, you can't see the pop-up box, but I know this person has asthma, gender dysphoria, and stress of CKD. If I double click this, you'll see the gender dysphoria box is just part of the bigger box for this patient. It's reminding me that they're eligible for pneumococcal. It has the asthma review there, and it's suggesting, listen, they're quite high SABA use, more than 40 a year. There's no reversibility coded. There's the DOAC review for this patient. Again, with all the various links and things for that. Orbit score if you want it, and it's highlighting their orbit risk factors, proposing a CKD code, and then here it's got the gender dysphoria. So it pulls it all into one. Now I know some of that can feel a bit overwhelming and you wouldn't necessarily want to do it all in one consult, but at least it's all there if you want to do a full holistic review. If that patient is in anyway for their asthma review, then crumbs, you're adding the gender dysphoria review. They're going to be in anyway for their kidney function, for their CKD if you're doing that, and you're just adding the other tests in. And frankly, I think it's just, we should, it's good care, but it's also easy money.